Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Ham-Lee. A recent 60 Minutes report on bird flu sounded the alarm on the spread of the disease from birds to cows to humans. It is now spreading to other mammals, and scientists and infectious disease specialists are concerned that if we don't get a handle on it soon, bird flu could spiral into a pandemic that would make the COVID pandemic look like, quote, a walk in the park. The Biden administration was slow to put programs in place to test for the virus, and the Trump administration has laid off hundreds of CDC scientists and health workers who track bird flu. And now there's talk of more cuts to the Centers for Disease Control and other federal health agencies. What does all of this mean for your health? Some answers when Another View comes right back after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Today is Another View on Health. So a couple of things to talk to you about that you may be interested in doing this weekend to make sure that you stay healthy. So on Saturday, April the 26th from 10 a.m. to 1 p.m., you have Celebrate Trails Day, which is going to be a free community event and day of service on the Elizabeth River Trail. They're going to have games and activities, litter cleanup, mobile bookstore, donation raffle for plants, and ERT merch, and a whole bunch more. That's happening Saturday from 10 until 1 at the Lamberts Point Micro Farm at the corner of Elkhorn Avenue and 25th Street in Norfolk. On Sunday, there is a screening of the 2025 Oscar-winning film for Best Documentary called No Other Land. And it is talking about the Palestinian-Israeli conflict, and it is a powerful documentary. It is being held on Sunday, April the 27th at 2 p.m. at Coastal Virginia Unitarian Universalists. That's on Military Highway in Virginia Beach. Now, it's free admission. They say join us at 2 p.m. when the doors open. The movie begins at 2:15, and then there is a panel discussion afterwards. And then finally, next Wednesday, April the 30th, on PBS, Nova is doing Critical Condition, Health in Black America. There it is. Critical Condition, Health in Black America. It is a show that promises to delve deep into a pressing issue affecting many lives, and it is going to uncover the reasons behind significant health disparities faced by Black Americans. So that is on our sister station, WHRO TV, TV 15, and that is next Wednesday, April the 30th at 9 p.m. And with that, you know, it's in its 2026 budget request, the Trump administration is asking to eliminate programs provided by the Federal Health and Human Services Department, like preventing lead poisoning in children, heart, obesity, diabetes, and stop smoking programs, and cuts to rural hospitals and healthcare. So what will be the impact on American health if these programs go away? How critical is funding for public health initiatives? Here to give us some perspective is our favorite cardiologist, Dr. Keith Newby, who also serves as the Market Director, Community Health Improvement and Engagement with Bon Secours Mercy Health. Hey there.
Hey, how you doing?
I'm good. How are you?
Always a pleasure to be in your presence.
Well, I appreciate that. And so you are, if I'm not mistaken, 3 classes away from a degree. Four classes away. 4 classes away
December.
from your degree in public health.
Yes, I am in December of 2025. I am out. I'm done. I'll be writing my last paper. I'm going to tell you, boy, it's been an interesting experience, but it's been a pleasant one in terms of what I've learned. There's a lot of things in public health that you don't really think about. Things just happen. Mm-hmm. And I will have to say this helped me tremendously as it relates to learning the art of community engagement. I've always done it, but knowing how to do things the right way when you're engaging communities, understanding dynamics of what impacts health. Because we hear that term social determinants. We talked about that before. Those are things that, we weren't really taught in medical school. How the community in which you live can impact your health, both short and long term.
So when you hear about all these cuts that the Trump administration is proposing, from your experience now with public health, from your experience as a doctor, what's your overall reaction first, and then we can talk about some specifics.
I'm gonna see how can I say this diplomatically. I would say this. I think when people who have a certain degree of privilege already are in charge of seeing what's needed and what's not, I think that tends to have you have a jaded perspective of the world. I am the first one to tell people that, yes, I think we all should be held accountable to our behavior patterns, but you have to take into account upbringing, the environment which you grew up in. And a lot of times, when you hear that term, somebody will say, all that person just needs to do is pull himself up by their bootstraps. Well, the question is, do they have bootstraps to pull on? And if they never had that, then you wouldn't always understand. Or if you have where, say, as example, a factory is placed in a certain neighborhood that's predominantly housed by certain individuals, they may be affected health-wise through no fault of their own. They just have to be victims of circumstance. Right. That's kind of stuff you have to take into account, that the world sometimes doesn't always make sense in terms of why things do or occur, why they do. However, understanding that piece and then taking a step back and sometimes say, let me look at that community and why is this affecting them specifically can help. So when you talk about cutting programs that could help identify those things and hopefully help correct them, because to me, my Christian beliefs, every life is worth saving, and without a doubt. My physician beliefs, my Christian beliefs are always every life is worth saving. So if that's something that would help do that, I don't think we should necessarily cut anything back. Now, money that's not being utilized appropriately, that's different. But, most of these programs,
just take it away.
Just take it away arbitrarily without any investigation, understanding how this is impacting positively or negatively. They just arbitrarily say, cut this, cut that. I just think that's wrong.
So when, things like, for instance, when we were talking about the bird flu in the T's, the fact that all of these scientists that are studying it, they're saying now, at least according to the report, that people they're not able to test people to see whether or not they actually have it, or if they have the antibodies that would be present, if they had it. There are all these things that we need to be trying to be proactive so that we don't have another COVID type
I think
outbreak.
The first, to me, if you start cutting out the jobs that are the scientists that are helping to resolve some of these questions, the first question in my mind is always, why now? What about, if you talk about bird flu, what is it about that virus? Is there something mutate and now it's more accessible to humans or whatever? I know it's not like a ton of human,
right,
victims.
not a ton yet, but they're trying to prevent it.
Yeah. But the question becomes is what's transpired that is making it where you are able to catch something you used not to be able to catch. So that's where the science work comes into play, because if they can identify that, if it's a mutation, then it's much more easier to figure out, okay, is this going to be a threat, and to be proactive to figure out now before it becomes, because COVID was a hot mess. I mean, when you think about the and all of what it went into developing a vaccine, trying to treat the thing, because people still die of COVID. I mean, it's just not like it was 4 years ago.
It's interesting because on the bird flu front, according to the report, they were saying that there is a vaccine for it, but it hasn't been approved by the FDA yet because
I know, because
it goes all the way down the line.
A lot of them got cut too.
Yes,
so
exactly.
Again, this is the thing. I mean, a lot of people will think, and I don't ever doubt that there's evidence of government waste, but it's the what I think should transpire is a deep dive. You come in, you say, okay, let's look at what are all the departments we need to look at. Start to who's spending the most money. Okay, let's look there first. Let's do a dive with the people who work there. Find out exactly what do they do, how do they do it, what are the things necessary, what's their productivity, how many employees they have, who does what, and then you involve them in that decision making to say, okay, let's start looking at what's being spent and how is this benefiting the world at large, meaning the United States. Then you can say, okay, we think, but that should be with that department involved in those decision-making processes because they know what we don't know. Because me coming in and looking at a department, if I don't work that department, there are going to be things I don't really know. Right. Involving them, that to me is the way it should have been, not just, let's just cut, because you don't know what that person did. And again, here we talk about this approval for a vaccine. If the people that were approving it are now gone, who's going to do it? Because then you're asking other people to pick up their slack and do their work for them, but you don't know what they have to do to know, can they even do that?
So one of the areas that will be affected if this memo that the Trump administration has put forth for the budget would be rural health. I know that there's already a shortage of doctors in the rural community. I mean, what is all of this a deterrent for people to even go into the medical field at this point?
I don't think so, personally, because, I think it depends on the rationale in which you're going into medicine. If you're going into medicine, I think to make an impact on somebody's life, I think you should still do it. I still have no regrets on what I do, and I still love what I do. They're just making it more difficult for me to do what I do. But I think personally, if that's your passion, I think you should still go for it. Because all you're limited, because this is just about federal funds. We're not talking about state funds, local things that you have. This is all federal dollars. So it depends on what branch of medicine you go into and how that may impact you. I'm thinking about, because, most residency programs are funded by the federal government. It's Medicare funds. So the question becomes in my mind is, would that be affected? Medical education is going to be important because you got to have enough providers to be able and right now we're short now. But a lot of that's basically the cost of medical education is so expensive. So I think, personally, I would never deter anybody. When I was a young fella many moons ago, I remember when I was going into medicine, one of the things that, and I'm pretty bullheaded, as you probably know.
No, really?
moving right along. But I remember at the time I had doctors that were trying to dissuade me from going to medicine because of their bad experiences. And in my mind, I would say, man, why are you raining on my parade? This is what I want to do. And those are just people that had kind of sour grapes about whatever was going on. So when people ask me, I say, well, what's your passion? Is this your passion? Because if it is, then I say, go for it. I don't care the struggles you might have. What I care about is your impact you think you're going to make on somebody else's life. And if I deter you from doing something that was your passion, then I got to deal with that later on down the road.
So there were some cuts that they were talking about that would affect smoking programs, for example, which then goes to your heart, obesity. These are all things that are really prevalent. They're prevalent in every community, but they're really prevalent in the Black community. So then the state, I guess, would be responsible for picking up some of that to continue that work.
Well, they actually fund a lot of that now. The Virginia Department of Health has a smoking cessation program. Now, what I don't know is, do they get money from the federal government to sponsor that? Now, that part I do not know. The downside with smoking cessation is that's a tough nut to crack because any drug addiction program, which essentially, nicotine is a drug, and that's probably one of the hardest addictions to break. So the unfortunate reality, I can't say too much on that one, only because when you look at success rates of smoking cessation programs, it's probably about 13-14%, to be honest with you.
Is that mainly because people just don't go to the program, or it's just that hard to quit?
Yeah, it's hard to say because they don't really talk about what the challenges are.
I have to tell you that I did kind of chuckle to myself because they've also eliminated, last year the Biden administration had put in to get rid of menthol cigarettes,
Yeah.
and now that's been rescinded by the Trump administration.
Lordy, okay. I'll see.
And for those who may not understand why we're chuckling, that's because menthol cigarettes are big in the black community.
Yeah, it's anyway. I tell you, it's just. I think I would feel better if I didn't feel like it was just a target at us. It's like this. I feel I'm looking at I'm checking my back to see is there a target back there. It's just the way things are going now. I'm not I don't dismiss that things could be done a little differently, but it's like a target, and I'm like, well, hold up now. Everybody here is here for a reason, and we're all immigrants, to be honest with you, with few exceptions. So, to me, I look at it as, I almost feel like, was Rodney King? Can't we all just get along? And there's so much to be done, and so many things I think we could do as a community that could be helpful to all. So programs I'm developing now are more designed that won't involve federal dollars, but we're looking at how do we improve the health and well-being of our community. And that's really what it should be about, because most of it is about lifestyle change, avoiding certain things, and then you think about like the ultra-processed foods, and we talked about this before. There are things that, unfortunately, we consume that put us in harm's way, and then you're going to cut the stuff. To me, if you're going to cut something, let's start cutting some of that stuff. Take away the access to ultra-processed foods. I don't know if you remember, I was telling you when Marcella, my daughter, when she went to UNC, she went to Ireland for that first semester, and one of the comments she made to me was she really enjoyed it over there. I had to drag the kid back. My wife had to go get her to make sure she came, because she was like, Dad, I love it over here. She said, but she commented about the food was so much better there. And kid lost like 15 pounds in 4 months just eating 3 meals a day, but what she was eating was different. And when you around, that's why I tell patients here locally, I understand the strife because of what you're exposed to. If you're exposed to healthy options and that's all you have exposure to, then you're going to eat, when in Rome, you do it as the Romans do. But when you're here, and the access to this stuff is so easy, but the I give you a prime example. The last class I did was on global nutrition, and we looked at, and I had to pick a country, a low-income country, to look at the nutrition in that country. So I picked Jamaica. And if you look at, now they don't grow their own food much over there anymore. They all import in from us. So what happens, the obesity rate has gone up, I think it's 45%.
Really?
Ridiculous numbers. And the incidence of diabetes has gone up tremendously in Jamaica just in the last probably 15 years behind imported food. So they stopped growing, and I had to do that as a project to say, if we change that narrative, how would that impact their short and long-term care? They had a tremendous increase in obesity rates in Jamaica, and behind what imports from us. So you kind of look at it as that's partly what the issue is.
So the getting rid of the red dye and that kind of thing, that's a step in the right direction.
But just when you think about like these bars, these so-called nutrition bars, or like the drinks we have, and you think these fruit juices that don't really have fruit juice. It's like 5% fruit juice and 95%
sugar.
Sugar. So it's just the unfortunate reality is what we're exposed to. And like I say, it's hard to hold people accountable for what they're exposed to or what they can afford. Yeah. So that's the other thing, is really how do we change that narrative? Because what I'm trying to think now is how do we make life better for those around us who are running to victims of all this stuff that the government's doing right now.
So, do you think that, again, because I keep asking this question of people, whether or not you think that ultimately this will bring community back together, because we're going to have to be so much more self-reliant, reliant on each other, as opposed to being reliant on the federal government to handle it.
I think the potential's there. The question is just, will somebody step up to lead the charge? Because that's really what it's going to take. This is different than like in the 1960s. You think about, when we were going through the Civil Rights Act, and communities then were much more tightly knitted. But at the same time, we had schools, we had banks, we had businesses.
Yeah.
A lot of stuff's fallen by the wayside, so it kind of puts you in a different place for your future. But I think the potential is there, but people have to be on the same page, and that's where I'm hoping that we can start making some changes. I think I brought up the garden stuff, like stuff Peggy does, my wife. She, and I was looking at trying to see maybe we should look at, instead of necessarily farming, which is difficult, especially here, because just soil. Yeah, you could do some local things, but should we be looking at some of these tower garden things and just get, because they actually sell them like as a community garden that you could actually grow it. It'd be self-sustaining, but you do enough of them locally, you can produce enough food for people. You just have somebody just has to, take care of it. But if you take good care of it, it would take care of itself. You just got to make sure the water's in there, what have you. But I look at the outcomes. Could that impact where people could have better access? The downside, though, is they still going to have access to the old stuff. One of the other things.
So how do you get people then to change their mind? Because I know that you have patients that come in who have heart disease or have some sort of issue that it could lead to to that. And if they're having a conversation with you about, this is what I eat, this is what I do, and you really press them, and I know this from personal experience.
What are you ever talking about?
But the point being, how difficult is it to change someone's lifestyle?
Very difficult, only because of exposure. You think about, again, I think about Marcella when she went to Europe. What she adapted to her surroundings. And she was actually okay with it in the end because she felt that the food she ate was more filling, less calories, and she got used to doing it. She even said the pastries were low in sugar there. So, she adapted to the surroundings. The problem is when it's almost like, say, if you're trying to stop smoking and somebody's got cigarettes around you all the time, and they're just laying around, and you say, okay, I can go over here and drink this bottle of water, or I can go over here and smoke a cigarette. And if you have access to it all the time, you're going to want to do it. It's human nature. It's hard to break that. Now, if you take all that away, which I know it's not going to happen, but if you did, I think you could find, yes, you could. I could answer that question definitively, yes. It's just what you have to do is try to convince people that what they're doing, it's almost like this despondent kind of nature people have now. It's like, well, like I have people say, oh, you got to die of something. I'm like, well, yeah, but I ain't trying to get there any earlier than I need to. But there are people who, unfortunately, so their life is such a shambles in their mind, what they've dealt with, the adversities they've had, that they just become despondent to their health care. Now, that's not, not a ton of people, but there's enough out there that, and people, I always joke about my weed smokers, but I think a lot of times people do that just to escape.
Yeah, that route you take from your office to the hospital sounds like it's a hopping route.
But the thing is, it's just a common neighborhood, that you wouldn't think that was the case. But I've never, in the last year and a half, I've never walked from 21st Street to the Centennial Norfolk General and not be exposed at least 3 times. Passing, never, ever, ever, ever in the last 3 years. And I walk pretty much every day, with the exception of if the temperature's less than 30, I'm driving. If it's raining like all get out, I'm driving. But short of that, I walk every day, and I've never, ever walked that, and I don't smell at least 3 times. I'll pass a apartment complex or cars. Sometimes listen, they're driving, go Hampton Boulevard. They don't play. Yeah. Them people driving 60, 70 miles an hour on a 35-mile-an-hour zone. And if you going that fast, you go past me, and I get a massive whiff. I'm like, what?
Wow.
That's telling you how impactful it is.
So is that because people are stressed, or is it because it's legal?
Some of both, I think. I think people use that sometimes as an escapism, for the challenges they have. At least when I talk to some folks, they say this, life's what it is. And I say, well, there are other options you consider, but because again, I tell people the health challenges: 42% risk of stroke with
marijuana.
42%, well documented.
42%,
and that is just a new study just came out about heart attack risk with marijuana. It's pretty significant. So, and I tell people, I said, listen, you think about it, you're inhaling something foreign in your body. I mean, I don't care what it is. I mean, there's always going to be a health potential when you do things that are not normal. I mean, your body wasn't designed to inhale smoke, and swallow it and try to absorb it into your body. It wasn't the intent. So, I say all that to say it's well documented for that. So that's why I joke around with people about it a lot, because I try to make light so it doesn't feel like I'm coming down on people all the time.
Yeah.
But I try to say, listen, your health challenges are there, and you have to ask yourself, is it worth it? I'm going to tell you, because you think about cancer rates. We do better with cancer now, but the incidence is still high. And then you look at, who dies from cancer.
Yes.
And why. And this is why I say, so when you talk about cutting these programs like this, these are programs that can help identify things early, and that's the part that troubles my heart is I'm all about other people. People that know me know when I ask for things, I'm usually asking for things for other people, not for myself. And, what we were placed on this earth to do was to be a help to others, in my opinion. So I think when you start cutting these programs out, I think the potential fallout is going to be extensive.
If you're just joining us, we're talking about proposed cuts to the Department of Health and Human Services and how those cuts could impact our health with cardiologist Dr. Keith Newby, Market Director, Community Health Improvement and Engagement with Bon Secours Mercy Health. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Are you concerned about the cuts that are proposed? And if so, what are you doing to make sure that you can do some preventative things now so that you can stay as healthy as possible? 757-440-2665 or 1-800-940-2240. I know that you had a recent roundtable where you pulled together a bunch of medical professionals and some of our community leaders and so forth. So what is the sense of what we need to do as a community, not depending on the state, feds, whoever, but as a community to come together and improve our health?
I think, one of the things that, in my opinion, you have to have leaders, the elected officials that truly have the best interests of the community in their mindset when you elect them. And I think really vetting people, we kind of gotten away from, it's kind of like we just believe what we hear and we roll with it. I mean, to me, I think, just like you interview people for a job, you should interview your elected officials and look at their history. What's been their voting patterns if they've been in some type of elected office before, and make sure that what they're proposing is in the best interest of all. I mean, that's the one thing I kind of get on certain individuals about. We have these debates about politics, and I'm like, I don't care what side of the aisle you're on. What I care about is your moral values. What do you believe in? I mean, and it's kind of like, there may be like a hot topic that, and I won't say any hot topics, but certain hot topics, and they'll focus on that alone. I'm like, but that doesn't negate all the other stuff this person is doing or believes in. You may say this is the one topic that means a lot to you, but the question is, does their entire pattern of their belief system is good for who they represent? And that's where I just tell people, I say, when I had that round table, and we brought in a senator, a U.S. senator, and a congressperson, and we sat down with them to discuss the challenges we have in our community. And how do we address it given these cuts that are going to be made? So I do think that there are good people in Congress. But again, there's no unilateral decision maker. I mean, this is, it has to go through the process. However, I think understanding, the one thing that I would say, and if you really could talk to your elected officials, kind of get a feel for where things are heading. Because at least then you can say, okay, let me combat it by doing X, Y, or Z. And I think taking an active role and again, a lot of people ask me, when am I going to run for politics? I said, I'm running home at the end of the day is the only thing I'm going to do. I have no interest in being a politician, but I do have interest in being an active role and helping shape where things head. So I think that to me is really, I wanted to expose the politicians to the community to say, okay, these are the challenges we see. How do we go about addressing these challenges? And I'm working with one of those senators to start looking at policies that are being developed in the healthcare sphere and hopefully help to navigate what might help our community as
So isn't
a
that
whole.
such a dichotomy? So we got one side of the government that is taking money out, cutting, slashing, firing, etc., and you have another side of the government that's saying, "Hey, let's take a look at what are the issues, what laws do we need to put in place." You know, there's this push and pull that seems to be going on
Just a polarization.
right now. Let's talk to Gerald in Zunai. Hi, Gerald. You're on the air.
Hey, ma'am, how you doing?
I'm good. How are you?
Hanging in there. But I just wanted to say, I think we can all agree that there were probably some cuts that needed to be made. But I think maybe, Elon probably missed the boat on the compassion, right? Because when you make those cuts, those are real people getting impacted, right? Real mortgages, real lives, real bills, and it was. I'm not going to disagree that some of them perhaps had to be made. I just think that the way that they were made could have been explained a little better, a little more compassion showed, and maybe some point-by-point reasoning on why, this job was saved, but this other job was, removed.
Got you. Yes, go ahead, Keith. Thank you for the call, Gerald.
I agree totally, but that goes back to my original statement of saying that I think that really should have been vetted. I think you go through, you look at each department, and you see what are the actual true needs of that area, and then what are they? What's the impact they make currently?
The other piece too is what is the impact? Say for example, the Medicaid cuts that they're talking about goes through. For average citizen who's on Medicaid, then you go to the doctor and hand them your Medicaid card, and all of a sudden you have no health care. I mean, ultimately that affects the economy. It affects people's lives, whether they're going to continue to live and so forth. And, do you think that people are keyed in enough to pay attention?
No, I don't think so. I think there may be some that are, but there are a lot I think that are not. I think they just haven't really studied the negative impact. Because what happens to a lot of people, when they don't have health insurance, they just go to the emergency room when they have anything done. So the hospital has to take a hit. But it's not just the hospital, because you think about it, if the emergency room gets flooded with standard medical stuff that could go into a doctor's office, that means when you get sick and you have to go to the emergency room, you got to be in line with everybody else. That is overwhelming, or it's an overwhelming situation that unfortunately, so you're going to be impacted because you're not going to get immediate care because there's going to be 800 people in front of you. So I think, to me, I just think a lot of stuff is short-sighted. I don't think they've really looked at it as, okay, if we do this, how is this going to impact? But one of the things that the caller made a comment on, in my opinion, if you're going to, like I said, if they were to ask me, okay, I want you to help with, addressing budgetary issues, I can't say, well, you do a contract with me to I mean, you can't sit there and say, I'm a benefit from other people's misery. Yeah. It's hard to have empathy when you do that. I'm like, to me, if you're going to take on that role, you need to devoid yourself, because the question becomes, human nature dictates that if you have access to get something, you're likely going to take it. Human nature, not everybody, because there are people who live above board. But to me, to even have the issue, that's why the government was so big on saying you can't have hidden agendas, or ulterior motives in what you're doing, and you have to devoid yourself of anything where you're going to benefit personally,
right,
behind any changes that's going to be made. So to me, that was my exit strategy right there with that scenario. I was like, you can't benefit from it. And then, I mean, because then you don't have any empathy, because then I'm saying, okay, well, then you need to take the cut too. If that is the issue, we're going to be efficient. That means all that stuff needs to go away, and you can't individually benefit from anything. But that's neither here nor there. I just think that's kind of where we're heading, though.
A fundamental question. Is it the responsibility of the federal government to take care of our health at all?
Well, I mean, look at other countries. I think it's don't quote me on this one, but it's either Switzerland or some European country that has the best government healthcare system in the world. I think, don't quote me on that, but it's one of those countries over there, and the government runs it, but it's so efficient, and apparently that's like the best. So, I mean, I think to some degree it would be helpful to have somebody, because the thing is, we're a capitalist society, so you kind of want to say anytime you have somebody, helping to run something, you want to make sure there's no hidden agendas of, some benefit they're going to have. So you want to make sure that that's not the case. So I think that's why I would not be opposed to government intervention. The problem is, with the way this society is set up, it's hard to avoid it, because who donates to campaigns? A lot of these folks that which is going to influence the government decision making, and that's the unfortunate reality. But yes, I think they should have some involvement. It's a matter of, to me, it's just the setup. They shouldn't be involved with the decision making of medical conditions. I think they should be I think they should just be the conveyor of funds necessary, and and everybody needs to put into the pot, of how that gets done, meaning finances. But and I don't have a problem with them fostering the system, but just not the decision-making process.
Yeah, because that continues to be an issue for doctors, doesn't it?
Absolutely.
Especially with the insurance.
I'm going to tell you, the games, it's just crazy. I mean, and a lot of patients, see, the thing is, what I found, insurance companies that do this, they love to do this game. They'll say, all your doctor has to do is just put in this script, and we're more than happy to pay for it. I mean, they literally say this, and they'll say it with that tone. You put in the script, deny. You need to do a prior authorization. Okay, fine. So that's more paperwork we have to do. You filled the authorization, prior authorization. Oh, but have they tried this cheaper drug? No, because this is the best one for them. Well, then we still not gonna pay for it. Then you do a appeal. So by this time, all this time has gone by. Now they tell the patient, all your doctor's got to do is this. But the realities are, it doesn't work that way. And I want the public to hear this, because they think we're just slack on our JOB. Right. I'm like, listen, I'm trying to save lives out here. I mean, but these people are making me stop what I'm doing to fill out a form. This, and I've noticed that even with drugs people have been on for years. I have one in particular that is still a brand name drug. Patient been on for 6-7 years, great blood pressure. But now they want to, we don't want to pay for that anymore. So they make the patient go through this process where they know they're going to try to deny it anyway. No matter what process you go, they need to try these other drugs. And they're going to want you to try at least 3 other meds. And I had one patient in particular like that.
So are these doctors who are making these decisions?
No. People, these high school kids, I don't know that for a fact. But I tell you, but this is the issue. Is I don't know who actually makes that decision on the drugs. I really honestly don't know where that comes, because you can't find out who is actually doing that. And I understand that what they're trying to do is save money. I get that part. But when we're on the ground level dealing with patients every day, so we kind of know how we need to treat this particular problem, because we know all the nuances of that illness and that condition. Well, when you have somebody who's never seen the patient, never dealt with the patient, has no idea what they're going through, to tell you how you should manage this condition. And I'm like, well, hold up now. We done been down this road before, and that didn't work. We did all the stuff, because I'm a Duke guy. We're data-driven. So I go through the process. I look at American College of Cardiology, gives us dictated guidelines in which we should practice medicine. And that's based on all the research done. And it's always updated. Every 2 years, it gets updated, of to how to address heart failure, how to address hypertension, how to address coronary disease. So they say, I give you a prime example, heart failure. 4 drugs they want them on. I won't say names of drugs. I just say there's 4 drugs in particular, 2 brands, 2 generics. This is the data has shown you're improved.
These are the most impactful.
Most impactful, life-saving, heart-improving drugs out here. But because 2 of them are a brand, you don't know the fight we got to go through to get them on.
To get the brand. On
drugs that are FDA approved for this indication, have all the supporting bodies of, the American College of Cardiologists. This is how you treat heart failure. These are the things with the best outcomes. And then you got to fight with a carrier about that. And Medicare is the worst. Because and I understand the cost of this stuff. But to me, if you start to really look at the grand scheme of problems, obesity, which is made worse by the types of foods we have access to, which leads to the hypertension and the diabetes and the cholesterol problems and the coronary disease, then the heart failure, then all the other medical conditions, cancer rates. It's a big circle. And so it goes around. So it starts from childhood, and it goes up into adulthood. Look at, fast food commercials. Who do they target? You'll see certain individuals up there. So all this stuff gets targeted. But and I understand they're trying to make money. I get it. It's just the long-term effects on people's health, which then leads to the higher cost of medicine because they got to be on this stuff because of the stuff they were eating from before. Instead of hit the root cause, change that. Then all of a sudden you don't see as much of these other things.
And I guess that's the thing that gets it so confusing. So now they're speaking of like starting in childhood, they're talking about cutting Head Start.
Yeah, I know.
Which gives children healthy food. A head start.
Yeah.
By the way, Taiwan ranks as the country with the best healthcare system globally, with an overall score of 78.72, South Korea 77.7, and Australia 74.11.
Now what is that for?
Closely behind. The best healthcare systems.
Okay. Huh.
Yeah,
I don't remember Taiwan, but again,
according to my crack producer was on it.
Okay, yeah, I'm just thinking about it. So I thought it was somebody else, but that's okay. Yeah. I mean, the facts are what they are. I know there are people now. Some of those, because Asian Americans and Asians in general have higher longevity. Period. And I think that's lifestyle. I think a lot of our issues are typically lifestyle driven. You look at the states, again, the comment made about Jamaica, where their obesity rates increased based on the types of foods they were exposed to now. So you got that playing a factor. So I think it really boils down to what we eat impacts so much on our healthcare and the lack of activity, because now we're in an automated society, so we don't do the things we used to do.
Right.
There are people that still work out a fair amount, but even, people that talk about me walking to the hospital, and they comment about that all the time. They say, I see you walking. I want to stop and give you a ride. I said, I'm doing this for a reason. I said, I appreciate that, but I said, I'm walking for a reason, and this is lead by example.
So we got about 2 minutes left in this segment. Tell people what we should do to make sure that we try to start to be healthier or maintain our health as we go through all of this, because we don't know where this is going to end up, but we still have control.
Oh, it's Jay.
So
I think the first step is always, identifying your health challenges. Go to the doctor, understand what your challenges are, and then formulate your plan of action as to how to address it from a lifestyle perspective change. And most of it is always going to fall down to what you eat, your lack of activity, or and your general health in general, stress reduction. And I think if you do those things, you'll find that will start your process up to a healthier life. And then it's a matter of identifying how you get there. But the thing is, be careful about marketing foods that you eat, things that say like low sodium, or says this is going to also affect your cholesterol in a positive way, and you're like, oh, that's crap. That's not going to do anything. But low sodium is just it's a marketing scheme, because if something has, if you're supposed to, 2,000 milligrams is supposed to be your maximum salt intake
for the day.
So if something has, say if something has normally 6 grams of sodium, 6,000 milligrams, they can change it, make it 5,500. They can say it's low sodium because it's low sodium compared to what they used to do.
Gotcha.
So you got to really look at labels, understand what you're putting in your mouth and how it's going to impact your health, and then you can move from there.
Okay. All right. As always, thank you so much. And next week, next month, we're going to talk about research and why research is so important.
I'm a Duke guy, so I love it.
Absolutely. And stay tuned, everybody. We'll be right back.
A tisket, a tasket, a brown and yellow basket. I send a letter to my mommy. On the way I dropped it. I dropped it, I dropped it. Yes, on the way I dropped it. A little girl.
And welcome back. She's called the First Lady of Song, and she was born in Newport News, Virginia on April 25th, 1917. Ella Fitzgerald was the most popular female jazz singer in the U.S. for more than half a century. Everybody loved her. Rich and poor, people of all ages, nationalities, and religions. The one thing they had in common was Ella. So Jay Sennett is here with us to talk about HR Jazz Inc., which is his nonprofit, and the Ella Fitzgerald Jazz Celebration. What's happening?
It's something. It's a city-sponsored event. They brought us in to produce the event. There's the Ella Fitzgerald Music Festival, and then there's the Ella Fitzgerald Jazz Celebration. So I want people to know it's talking about two different things. In our case, it's the Ella Fitzgerald Jazz Celebration. We're talking about Ella Fitzgerald, right? And her birthday would be tomorrow. She would be 107, actually.
Wow.
Born in the city of Newport News. So the city brought us in to produce something to honor her, and it kicks off on April 30th. We're bringing in the youngest of the Marsalis brothers, Jason Marsalis, to the Downing Gross Cultural Arts Center over there on Wickham Avenue in Newport News. Jason is a magnificent percussionist. He's focusing on vibes now. He's one of the best drummers in the world. So I'm a little intimidated playing with him.
Really?
I thought you were. Hold up, Dan.
But
I thought you were.
He's before I woke up this morning. Right, but he is focusing on vibes now. So it's going to be a quintet with Rahsaan Barber playing tenor. It's Alan Johnson out of D.C. playing piano. It's going to be a swinging night and a great way to open the festivities. Okay. Then on the 3rd, vocalist Kenny Washington, one of the best in my view, one of the best male jazz singers today on the scene, will open the show for the Yellow Jackets. And it looks like this show might sell out. So I want to tell people, if you want to really come out to see that show on the 3rd, get your ticket at the Ferguson Center. Okay. At the Ferguson Center, the smaller theater, the People's Theater. Fantastic for jazz, instead of the big rooms. It's great for jazz. May 8th, the Ella Fitzgerald Jazz Vocal Summit with Vanessa Rubin, Renee Marie, Tierney Sutton, an extraordinary lineup of female vocalists paying tribute to Ella, also at the Ferguson Center, May 8th. Wow. May 9th, back at the Downing Gross Cultural Arts Center, multi-Grammy nominated singer Roberta Gambarini, one of the best singing today at the Downing Gross Cultural Arts Center. The Downing Gross concerts, by the way, tickets are available at eventbrite.com, not through the Downing Gross. That's important because most people go see shows at Downing Gross used to getting their tickets there. But they're at eventbrite.com for our two shows there on the 30th and the 9th. And then wrapping it up with Hampton Roads artist, the amazing singer Liz Terrell Bridge over at the Reformation Lutheran Church off of Warwick Boulevard. Great room in there, beautiful piano. Eventbrite.com to see Liz Terrell. So we have 5 concerts.
Wow. What did it take to put 5 concerts together?
Losing my sanity. Yeah. That's it. And it's just conceptually bringing in artists that, one, represent this music at the highest level, but also understand conceptually who we're honoring here. Like every artist coming in, even the Yellow Jackets, right? Can you do something, a tribute to Ella? Yeah. And they said, yeah, well, they're all great jazz players, even though they do some groove, funkier things. I'm real curious what they will do.
I know, because I love the Yellow Jackets.
Yellow Jackets, man. I mean, they have masterfully merged soul, jazz, fusion, funk, gospel, all of it better than any band that I've heard do it, right?
Then Keith, I know that you're on the board of the HR Jazz also, but what does jazz mean, this type of jazz coming back to the area and being so prominent? What does that mean to you?
Well, I think my relationship with Jay goes back to years ago. That was something that I know I love. I was a music major when I first started college. Obviously, I learned I wasn't good. Listen, obviously, I learned I wasn't good enough. But I started to say jazz was. I mean, I started listening to jazz when I was in the 4th grade.
Wow.
And listened to Lester Young and I mean, just some of the Miles Davis. I mean, these guys are just. I mean, you think about the ability to convey a story through your music. To me, it was just phenomenal. So I've always been a fan. So hooking up with Jay, because Jay's big on true jazz. It's not fancy R&B instrumentalists, but true jazz. And that is where, and it's one true American art form. And we need to that's a cultural thing that we should be emphasizing and pushing. So to me, that was really what prompted me to say I want to be involved to some degree. I mean, it's harder for me just because of what I do for a living to be so involved, but I'm always there in support of anything Jay's doing. I mean, he's the man. I wish I could be like him when I grew up.
So Jay,
Keith chose medicine because he wanted to make some money.
So in about the minute and a half left that we have, if Ella wasn't from Newport News, I mean, I know that's part of the reason why we celebrate her, but give people that may not know why she was so special. What was so special about her?
Well, her versatility, first, for starters, but she was a black woman in an era of deep segregation, man. I mean, and to have, it's Duke Ellington too, to have that extraordinary kind of success, considering the societal mechanisms that were in place back then. But Ella also, it was her versatility, it was her ability to sing, just how the woman could sing. And she was that rare talent that came along at the right time, right? At the right time that shook the world. When she brought out a Tisket, a Tasket, everything changed after that. And then from that point on, thousands of vocalists, not just female, thousands of vocalists all over the world were enamored with her talent, with her gift, and celebrated her through the rest of her life, even when she was still performing.
Yeah.
Right. So she's one of those rare, supreme talents, like Louis Armstrong, like Duke Ellington, the instrumentalist, right? Well, Pops also sang too, but Coltrane, Miles. She was at that level.
She was at that level using her voice.
Yeah.
Wow. So give us the website where people can go and find out more information about the concert.
hrjazz.org. You can see the lineup again. It's all over. The city of Newport News has been spectacular in promoting this and keeping it out there. But hrjazz.org under the events, you can see, and you can see again where you can get tickets. Ferguson Center, Downing Groves Cultural Arts Center, and a Reformation Lutheran Church.
Fantastic. Thank you so much. And thank you, audience, for spending an hour of your life with us today here on Another View. Please share this show with someone you love. Go to our website, whro.org/anotherview, or to Spotify or any place you go to listen to podcasts. Next week on Another View, meet 3 Black women who are making their mark in Hampton Roads philanthropy. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Victor Bowen is in for audio engineer Jordan Christie. Hey, and thanks, Victor. We appreciate you. Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Stay healthy, stay happy, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.